In an implant process, we have three types of occlusal scheme. One is bilateral balance, the second is group function, and third is mutually protected occlusion. So if you see what is balanced occlusion. In balanced occlusion, simultaneous anterior and posterior occlusal contact in centric and eccentric position. So both in centric and in eccentric there will be bilateral anterior, both anterior and posterior they contact. That is why it is called balanced. So the first anterior part and the posterior part, they are both will be touched. So where this is used, the first thing you can see is utilized in complete dentures. This is not used in implant process but in complete dentures. And you can see the contact on the non-working side prevents tipping of the process. So in complete denture, since it is not implant retained, chances of the process tip down and fall is there. So always there will be a contact point. In balanced occlusion, there will be a contact point. Even when the patient moves the jaw forward, there will be a contact. So this avoids tipping of the process from the position. The second is, it is rarely seen in natural dentition. In natural dentition, we are not like that. In natural dentition, when we move the jaw forward, the posterior disoccludes. So this is the phenomenon. This is called mutually protective occlusion. So the anterior teeth are protected by the posterior teeth. When the posterior teeth is in contact, the anterior teeth comes like this. So this is how God has created us. So if you see, but in a denture situation, it is actually a balanced occlusion situation. Unless advanced and extensive alteration is present, one cannot see balanced. If you would have seen a lot of Bruxer patients, there are a lot of patients have this problem of occlusion. This balanced occlusion you can see in natural phenomenon only in severe alteration cases. So in complete denture cases, we have this, and in RP5, removable process 5 situation, where the implant is placed and also the implant denture will be supported both by the soft tissue and also by the implant. That is called RP5 process. So if you see in this photograph, this is in centric occlusion you can see, and this is in protrusion. When the lower jaw moves forward, you can see all the teeth are in contact, the anterior teeth and the posterior teeth. So you can see this is called balanced occlusion. So in the next picture, so where it is used in fixed implant process versus conventional denture. In fixed implant process situation, we have when there is a fixed implant process and there is a conventional denture. Say in a unilateral case, this is the ideal way you have to give occlusion, and also fixed implant process with removable over denture also you can give this condition. So then the second thing is called bilateral balanced occlusion. In bilateral balanced occlusion, we have this lingualized occlusion, where it is a type of balanced occlusion where the maxillary lingual cusp articulate with the mandibular occlusal surfaces in centric and in all explosive movements of the mandible. Lingualized occlusion maintains the aesthetics and advantages of the anatomic form of the tooth while maintaining the mechanical freedom of non-anatomic tooth. So the second occlusion situation is group function. The first thing we saw is bilateral balanced occlusion. The second thing is called group function. In group function, it is otherwise called unilateral balanced occlusion. We have bilaterally contact. In group function, same thing, but in one side you will have. So it works as a group. So that is why it is called group function. In group function, it is defined as simultaneous contact between multiple teeth on the working side during expressive movement. Then suppose you move the jaw to the right side, that is called the working side. The other side is called the balancing side. So whatever side you move, that will be having contact. The other side will have an open bite, so that the cusp don't interfere. It is accomplished by having working side contacts and now non-working side contacts, thus preventing excessive wear of the centric holding cusp and maintaining occlusion. So this will not allow wear and tear to happen on the left side. The third thing is to share the lateral pressures to posterior teeth instead of the canine. This occlusion used primarily with compromised canine. When your patient is having compromised canine situation like wear and tear, you can use this group function occlusion. So it is invented by Dr. Clyde Schuyler. So the non-working side contacts are traumatic to the dentition, resulted in neuromuscular disturbances. So the non-muscular contact, suppose I am moving the jaw to the right side, if my canine is wear and tear is there, if it is having contact on this side, there will be a lot of neuromuscular disturbances. So it causes accelerated periodontal breakdown and it resulted in excessive attrition. So the third thing we are going to see is mutually protective occlusion. The first thing is balanced occlusion. The second thing is group function, otherwise called as unilateral balanced occlusion. The third thing is mutually protective occlusion. In mutually protective occlusion, if you could see, when you view a protrusive movement, okay, this is otherwise also called canine protective occlusion. The cuspid rise, otherwise called or organic occlusion. These are the three names. Now, what is the characteristic feature? The characteristic feature is an occlusal scheme in which the anterior teeth protect the posterior teeth in protrusive movements by keeping them out of contact in the opposing dentition. When you protrude the jaw, the anterior teeth will prevent the posterior tooth contact. So this will help the posterior tooth. So in mutually protected occlusion, the posterior teeth will protect the anterior teeth. In centric occlusion, when the jaw goes to the centric relation, the posterior teeth will protect the anterior, and the canines will protect the incisor and the posterior teeth during lateral expressive movement. The canine, when you move the jaw to the right side, the canine and canine will come in contact, causing it will prevent anterior and also posterior. So it is otherwise called canine guided occlusion or canine protected occlusion or mutually protected occlusion. So this is how it is. Canine and canine alone will touch, this side will not touch, this side will not touch. So this is the protective occlusion. Studies have shown that 2/3 of temporalis and masseter won't contract when posterior teeth do not occlude. So this will help unwanted neuromuscular activity. So the occlusal scheme is used when the full arch implant restoration. You can see a full arch restoration is here. Suppose you are doing a lower jaw alone you are doing implant case. So in that case, what you have to do, if you are facing a natural dentition, and also otherwise if you have a removal process, this is the ideal way of giving an occlusion. So additionally, with the full arch implant process, the following should be integrated: bilateral stability. You have to have bilateral stability, wide freedom in centric occlusion, and you have to have evenly distributed occlusal contacts, and you can see there should not be any interferences between the protruded position and eccentric position, smooth and even lateral expressive movements with working or non-working interferences. So these are the things: bilateral stability, wide freedom, narrow occlusal table, minimal cuspal height should be there, the forces should be evenly distributed, no interference between the retrograde position and centric position, smooth and even lateral expressive movements without working or non-working interferences. So if you could see in the photo essay, you can see this is a normal centric. In protrusive, you can see the posteriors are not in contact. So in the right side, when the jaw is moving to the say left to working side, when the jaw is moved towards the left, you can see left canine and canine is touching, and you can see the opposite side, the tooth are relieved. So this is canine guided occlusion, otherwise called mutually protected occlusion. When to use, I told you, when you have a fixed process versus natural dentition. When you have a fixed implant process versus fixed implant process, you can give this. Fixed implant process versus implant supported process, you can give this. So a good occlusal scheme is necessary for avoiding the morbidity of your process and also to increase the longevity of the process. So poor occlusal planning would lead to biomechanical stress and strain to the process, bone and soft tissue. So this is the by Carl Imisch. Carl Imisch has given us the idea of implant protective occlusion, where the first thing is the implant should be in ideal position. The second should be the surface area of the implant should be increased if you have adverse movements of adverse jaw movements. The third is minimalized cantilevers. The fourth thing is shallow anterior guidance. The fifth is occlusal guard has to be given. These are the 5 points for IPO. This is called implant protective occlusion. So if you see, this is the relationship. You can see the more in this picture shown is the interrelationship between vertical and horizontal overlap of the anterior tooth. To make the anterior guidance shallow, either decrease the overbite from B to A. Either you can decrease the overbite or you can increase the overjet. So you can see there is only one point of contact. So here you can see we have reduced the increased the in picture B. You can see the overbite has been decreased. Here the point of contact they have increased the overjet. So these are the 3 variations you can give. So the conclusion: occlusion plays a major role in the functional and biological aspects of the full arch process. So occlusion is very important. These are the generalized recommendations which I told you. The conclusion would be it is very important you plan your occlusion, and this is very useful to you. So thank you. If you like this video, please share this video, and also you can join our implant program, which is happening every 2 months in our academy. We give 5 implants to be placed on patients, and also we give cases to be restored, and everything will be taught in detail. Thank you and God bless.